not the greatest camera angle, but I'm going to set this up. Yeah. There we go. That looks good. Huh? Okay. Okay. And then I can do this. But I don't think it works running. Just like yeah. I'm checking out my phone here.
Good morning. Thank you all for being here. I was going to say thank you for practicing social distancing, but I'm not sure that that is actually happening. So I take that back. Now thank you for social distancing. Thank you very much, most of all, for being part of a critical team of individuals and organizations who are helping to assure for the public health in our community during this COVID-19 pandemic. These are changing times. We used to think it was weekly or daily, and now it's by the minute. We are a very strong community. We are a strong state and nation. And at the local level, the collaboration and working together that is happening related to COVID-19 is incredibly impressive. And that includes our friends in the media and all of the partners that are working on this. And I say, to us as a community, this is exactly what we need at this time, and it is exactly what I think we expect of ourselves whenever we face a challenge in this community. My name is Tara Johnson. I have the privilege of serving as the chair of the La Crosse County Board of Supervisors, and I will be facilitating today's media conference. I'm joined by our health director, Jen Rombalski, our associate administrator, Jane Claycamp. Jen will first provide an update on current status of the virus's spread in our community. Jane will then talk about modifications and adjustments to county operations that we will be putting in place. I will come back and say a few things about boring things like meetings and other gatherings. And then we will be happy to take your questions. We have our colleagues from both Gunderson Lutheran and Mayo here to help with answering questions, but let's get through Jane, first Jen, and then Jane, and then my statements, and then we will be happy to take questions, and I will be happy to facilitate that. So Jen Rombalski, Public Health Director.
Thank you, Tara. Good morning, everyone. I'm really glad to be able to speak directly to those in our public and help them understand what's happening. I think these messages are really, really important to be sharing. First of all, I do want to say that we have been notified as of this morning of our first confirmed case by lab tests, positive lab test result in a La Crosse County resident. Shortly after that case came in, another positive lab test result came in. I want to right away say we anticipated this. We have been testing individuals in our community. So to see test results come in of individuals that are positive is something that we expect to see at this time. So we received those two positive lab test results, and we do believe that others in those households have symptoms and will likely be determined as presumptively positive cases as well. They may not be tested for COVID-19 because the way the investigation process works is that they would be considered presumptively positive if they have symptoms because they've been in the household. So a couple of details that I want to share on these lab confirmed cases. They are females in their upper 20s to upper 40s. Again, they are members of households, but the two lab confirmed cases are females in their upper 20s to 40s. Their symptoms have ran from very mild to what I would call moderate. And the symptoms have included low-grade fever, cough, body aches, sore throat, and then one individual had headache and some GI upset that she described as her stomach hurting. No one at this time has been hospitalized in relation to their symptoms. These individuals are currently being isolated in their homes. Isolation is the term that we use to describe someone who has symptoms and is then being asked to remain in their house. The individuals are currently in contact with our public health nurses at the health department. We are conducting, as we always do with any communicable disease situation, we conduct interviews and we discuss with the clients, the cases, what contacts they might have had. We call this investigation, and we do this on a normal daily basis with many communicable diseases. So these public health nurses are very good at that process. We will then in turn determine anyone who may have been exposed, and we'll be in contact with those individuals, and we'll share more details as it is available. We anticipated again that we would have cases in La Crosse County. This is not surprising to us. So I will say at least twice during my talk that we do not need to panic about the fact that we have cases in our county. We knew this would happen. We are having this happen all over the country, and these individuals are not hospitalized, they are at home, and they are not very severely ill. That is not the case. So it has not shifted our guidance. Everything that we've been saying up to this point remains very consistent. Our current message is that we want people to stay home. If at all possible, we want you to be home right now. That is really to protect those in our community in particular that might get more severe disease, and that continues to be those that are 60 and over and those that have underlying health conditions. Individuals who are sick should not be at work. Wash your hands with warm soap and water frequently. Do not touch your face. Tests are not indicated to know what we need to do. We do not need to have a test result to determine, yep, we are sick and we need to stay home. So please keep that in mind. It has been something that many people question, is that if I get the test, then if that's negative, can I stay home? No. Test results indicate then we don't need to do the case investigation, but if you're in quarantine, you remain in quarantine for 14 days. If you're in isolation, you remain in isolation for 14 days. The test results do not change that. I cannot emphasize enough how important it is right now in our community, across the state and across this nation, to be calm. We are all in this together. Again, we expected cases. None of these cases have severe symptoms, so we're really grateful for that. Viruses do not discriminate, and neither should we. I would direct you for further resources and details on our website and on our Facebook page for the health department. Thank you.
Good morning, I'm Jake Camp. I'm the Associate Administrator for La Crosse County. So for the safety of our customers and our coworkers, beginning Thursday, March 19th, we will suspend all walk-up services except for emergency and 24/7 operations through Monday, March 23rd. So on Tuesday, we will have some new, or Monday afternoon, we'll have new information. This decision has been made in consultation with Health Director General Balsky, County Board Chair Tara Johnson, and Administrator Steve O'Malley. Phone-based and online services will still be available, and we ask that all customers contact the department before they come into the county. Public entrances will be closed and signed at high traffic locations that include, but are not limited to, the admin center, the law enforcement center, the courthouse will still be open and conducting business, and justice support services will still be open. Health and Human Services building, the household hazardous waste or materials building collection site will be closed, and the county libraries will be closed. La Crosse County employees are expected to report to work as usual to respond to phone-based and online services and help plan for future delivery services. Please visit the website at lacrossecounty.org to locate the department phone number and call before visiting the building. Employees will support efforts to rapidly modify and redesign our service delivery approaches. These services will be provided in accordance with prevailing federal, state, and local public health guidance. On Tuesday, March 24th, county services will reopen with redesigned approaches that drastically reduce person-to-person contact while ensuring welcoming, accessible, equitable, and efficient service options throughout the remainder of the COVID-19 emergency. We've all heard the message about flattening the curve by maintaining social distancing, and this is our way of flattening the curve and keeping the community safe, and also our coworkers. We realize this will cause inconvenience, but ask for the public's understanding to La Crosse County's response to the COVID-19 pandemic. And then I'll turn it back.
Last piece before we open it up for questions. At tomorrow night's county board meeting, 6 p.m. in the county boardroom, which is still scheduled to take place, the county board will take up a resolution declaring a state of emergency in the county. This action will provide county leaders with the authority and flexibility to make necessary and immediate decisions to further protect the health and safety of all La Crosse County residents. Just a note, along with most other counties in the state, La Crosse County has chosen to require in-person attendance of supervisors at regular meetings for lots of reasons. So our meeting tomorrow night will take place in person because one of the clauses within the declaration of emergency allows us to shift that to remote participation by supervisors for future meetings. But we will be convening tomorrow night and take up that item as a full county board as scheduled. With that said, and with that lone exception of tomorrow night's county board meeting, as of today, all other meetings of La Crosse County will be rescheduled, postponed, or canceled until further notice. So those are our three announcements that we wanted to make. Again, thank you all for being here. We have with us Dr. Paul Moling from Mayo System and Dr. Bridget Path from Gunderson Lutheran. So the five of us are ready to answer any questions, and take it easy on me because I'm going to try to moderate this. So questions of any of our experts and speakers. Ma'am. Sure.
Just wondering if the women that you mentioned, if they have any history of travel, or if you believe that these were communities.
Yeah, the question is there a history of travel or is there community spread? What I know right now is that there was one individual that did not have a history of travel that we would normally have been screening for, but the individual in the household that person lived did have a travel history. I'm thinking about the other individual also had travel history. However, it wasn't at the level that we normally would have recommended testing for. We do not. We're indicating La Crosse County at this time until we can do further notifications of those that might be at risk.
Do you understand how many people in the household could be impacted?
Yep, so how many people in the household might be impacted? Based upon our very early investigation, I understand that one of the households has, I think, 5 or 6 individuals in that household, and the other is a household of 3.
Is there any indication that travel, but not necessarily that you might have been safe, be cautious, and so isolate? Is there any reason to believe that they were out of the community before they started saying?
Yeah, so I think what your question is getting at is there a risk to the general population based upon these 2 households or individuals? And I think that while we can't say that there is no risk, I think the risk is low. We do have a number of aspects we're going to follow up on with the investigation, but those are individuals, households, and potentially we're looking at if one of the individuals was in school the day before symptoms began. So we'll be talking with the school But again, the risk is very low in all of those situations.
You know, roughly how long have these people been displaying symptoms?
So symptoms, I don't have the notes right in front of me. My understanding is both individuals were tested on March 16th, and I think symptoms began around the 12th or 13th. And so it's looking to us like the range of days is 3 to 6 days in terms of when they may have been exposed somewhere else and when they came down with symptoms. Yes, the question is, am I expecting more cases? Yes, we have a number of people that are being tested, and healthcare systems can speak to that. There are a lot of people that are being tested. So with all of those being tested, we do anticipate that out of some of those tests, we're going to get some positives. So yes, I do think that we will have additional cases here. I think our cases in Wisconsin will continue to go up. When that may level off, we just don't know. Good question. So the question is, are there any individuals in the household that would be at risk of having more severe disease? That answer is no. We do not believe that there are individuals in those households that would be older, for example, or are we aware of anyone who has immune compromised aspects that we would be worried about their risk?
And what's important for everyone to stay home during this time? What's the message to people out there who are still again to be practicing safe social distancing and those sort of things?
You know, again, these are unprecedented times. There are a lot of asks right now to the public that are difficult. We saw and are seeing schools that are letting their kids out knowing they may not see them the rest of the school year. These things are hard, but they are important, and they're happening for a reason. And that reason is to prevent the spread of this particular virus. And we know many people do not come down with severe symptoms, but it's our job to do the best we can to prevent that spread. And that is every single person in this community and beyond to think about that they have the potential to be in a location if they're out and about and become exposed and potentially share symptoms with others. And so we all need to do our part. So what is necessary to go out and do? We have been messaging for a while about being prepared. So that preparation message was about 14 days to be considering if you need to be home for 14 days, you have the food and the medicine and the over-the-counter supplies you might need if you're sick or someone in your household is sick. Right now, we don't want people who don't have to be out in the community, we want them to be home. Right now is the time to do that, because by doing that, we prevent the spread. And if we cannot do that, we need to be practicing social distancing 6 feet away whenever it's possible. And if you have any symptoms, you really should not be at work. You should not be out in the community. Do what you can. We are very creative. We have lots of resources these days in terms of ordering things online, going and picking it up, and we're not even getting out of the car. So I think being in your house and being in your car is where you need to be right now, if at all possible.
Are there questions of our healthcare providers on testing or other issues we can bring up, Dr. Path?
So I'm Bridget Path. I'm the administrative director for Henderson Health, and certainly I appreciate the partnership with the providers here. My training is in microbiology, and much like Jen, we've been preparing and planning for this for years. And many of us never thought that this would happen here in our community. And as she mentioned, the unprecedented times. We have seen healthcare systems, Dr. Moling as well has been, again, a part of this preparing and planning in our community. And we know that we've got test supplies, we've got the ability to test patients. The key element related to this infection is we do want you to call the healthcare system first. Don't just show up at the door if you suspect that you have signs or symptoms of this infection. please call us and we will screen to see who's eligible, who meets that criterion for testing at this point in time. Dr. Mully, you also have a time going?
Yeah, thanks, Bridget. Exactly as Bridget said, I mean, it's us being smart, intelligent, listen to what the county is saying, listen to what the state is saying, and listen to what the CDC is saying. There's a reason, there's a purpose. Please remain calm. That's absolutely important. We don't want people hysterical over this. Please remain calm. The health systems, both here, we've been talking for the last couple of weeks about how we're going to handle this. We've been in discussions with the county, with our EMS, with the fire departments, with the police departments, sheriff's departments. We're taking all necessary steps to keep our community safe. And it is up to each one of us individually to do that. Take that responsibility, stay home. I enforce this with my own family. Stay home. Testing, Bridget indicated, we are doing testing. I will share with you there's a national shortage of supplies for testing. I don't want everybody running out then saying they need to be tested. Both institutions, and we just reviewed it, have a protocol for being tested, who should be tested, who's at the highest risk, and why we should be testing them. From there, the testing will come back as we know these couple of individuals that did return. The county took it up. They're handling those cases just as we wanted. I emphasize that they are doing what is right. We're isolating, we're tracking down those individuals, and then doing isolation and precautionary measures. So I just share that please remain calm. 2 cases in this county, there will be more. But if we use good judgment and keep our wits about us, we will make it through this.
The question for you, you mentioned prioritizing those severe cases and things like that. Are you prepared for potentially an influx of patients that will require hospitalization?
Just to summarize his question, he's asking the testing around the patients and will that potentially increase the influx of positives and then hospitalizations. Both organizations have taken that into account along with the county and others. I'll say this is a joint effort in this community. That's what's great about this community. It was within minutes, both organizations were contacting each other. We were in contact with the county, our sheriff's department, our EMS, the police department, and the fire department. Everybody's taking a joint effort. There will be people hospitalized. We've had people in our hospitals for this. They have ruled out negative, and they've gone home. The people that do end up testing positives that have advanced disease, the acute respiratory distress, the viral pneumonias that will need hospitalization, we are ready for that. Again, the big key factor is our systems are ready, but they can be pushed. And we need to maintain social isolation, keeping people at home, keeping away from each other, because there are capacity issues. And that's what they experienced in Italy. How do you take care of so many? But again, all the measures that are being taken place right now is to protect all of us.
You know how many how many patients they have tested yesterday for COVID-19?
We tested around 50. I don't know how many.
The exact numbers within our health system I don't have available. I think what I can say is some of the important things in the last 24 hours, just like we heard them talk about the wellness visits, is you'll be hearing from your providers. We don't want people to call and say, do I have this clinic appointment or do I have this surgical procedure? Is it going on a schedule? And I think those are things people in the community should be aware of. We will be contacting you. We want you to call us if you have signs and symptoms of infection and think you might need to be tested for this infection. But as it relates to surgery, procedures, clinic visits, any of those things, we will be calling you.
So what Bridget is referring to is we're talking about elective cases. I did mention, if I did, I apologize. Both organizations have come into agreement of canceling elective surgical cases and trying to understand which patients need to be seen. Our clinics will remain open, but we're selecting which patients should come in and not come in. Both systems are figuring out how best to connect with these patients. We still need to deliver healthcare to those that are not sick but have comorbid or have morbid conditions or illnesses that do need to be addressed. But the way we do that is by taking good choices. The other thing to reiterate is to call the clinics for testing. Don't just show up, because the sites aren't prepared if you do show up, and plus again, we're congregating.
When you say us, when you say call us, who specifically should people call if they're experiencing these symptoms?
Okay, first of all, it's an emergency situation. I'll say contact EMS 911. For us, we ask that they call their primary care clinic for advice to triage, go through a triage process, and then for us, we're directing them to our drive-through clinic. I know we have something very similar occurring, but that's what we're asking.
Those phone calls to the general number at Henderson, and you will be routed to the right person. That's 608-782-7300. Anywhere in the region will get you right through. They will forward you to the appropriate triage line, depending on, again, signs and symptoms.
I think the White House talked about it during the press conference yesterday, leaning into telehealth, and I know this is something that both systems have worked really hard at establishing long before this started. Is that something that you're going to be leaning into further in the days?
Absolutely, I can speak as the meeting. Sorry, yeah, I'll repeat the question. So the questions around telehealth, video visits. Both organizations have been doing them for some time. Obviously, we're going to have to operate them. There was actually a discussion I left right before coming here. We're looking at our patient profiles, lists, saying, okay, who should we receive a phone call? We can handle that via phone. No, this person does need to come in for medical attention. We cannot negate that visit. So it's understanding who needs to be seen, who doesn't need to be seen face to face. Good question, though.
So say you had like a non-emergency visit plan, like with dermatology or your optometrist or whatever, are those
those are the exact cases. Yep, sorry. The question was, for those elective cases, I got to go see my dermatologist. It's my year for my annual mold, time for my annual mold check. It's time for my annual eye examination. Those are the visits we're exactly talking about. I'm not going to go into full depth of how, what, where, but those are the cases that we are vetting right now, and who needs to come in, who doesn't need to come in. And we're looking at about an 8-week period of time. I don't know what you're indicating.
And again, those things, I think the best place I can direct you is hendersonhealth.org, and the most up-to-date information for the public will be posted there from our health system. So the key points is if you're sick and feeling like you have a fever, going through your typical routes or telephone nurse advisors, or as Molly said, calling 911. Those things are the same, but the things that are different is if you're, typically if I just kind of have a runny nose, there might be days in the past where I'd suck it up and maybe try to work sick. This is not the time to be working sick. This is the time that we all need to be taking care of those around us who might be in those categories I heard somebody reference. So if you're sick, call us. If you're not sick and you have an appointment next week, that won't be kept. Somebody will be calling you.
Yeah. Same thing in our organization.
I know you mentioned the nationwide sharing when it comes to how are your organizations doing the process.
I will share. We have a limited supply.
So how are we doing in terms of supplies related to testing in our region, in our community? That's something in partnership, as was mentioned earlier, we've worked closely with La Crosse County, our partners at Mayo, our partners throughout our region, really, and evaluating that status and saying, let's keep in touch. We don't know what the supply chain looks like long term. The nation saw that as a whole last week, right? So if we think about the impact of binge buying and is our people hoarding supplies, I don't think that's what's happening. But you'll see, as in the situation described recently, that we don't need to test everyone in the household once we've established that COVID is present. And we will be evaluating and determining things. That situation may change as this progresses. as we see the viral wave spread across our region, across our country, what is the testing protocol and process? That may be addressed. Someone who wasn't tested Monday may meet the criteria for testing today.
We have some questions on Facebook. If you could address the status of drive-up testing at both of your facilities.
So our status of drive-up testing, the question is drive-up testing availability, I guess, at both organizations. Ours is currently open. It's open 9 to 6. It varies. It may vary depending on supplies. We're working with our colleagues at Gunderson. Actually, we've had phone calls back and forth. We're working with our colleagues across the nation, and also with our congressmen, congresswomen, all the way to the national level of how do we distribute and how do we get supplies needed for testing. We have not seen any issues with other supplies yet, but mostly it's around testing. It has to do with the number of, and it's like the perfect storm, I would call it, why the testing stuff is not available at this time, companies switching over materials, etc. But everybody's working hard, even from the manufacturer levels, to up ramp. So the question is, will we be testing people at the end of the 14-day period?
So right now, the recommendations, again, as I mentioned earlier, if we know someone's been exposed to COVID-19, testing is not needed to be aware that someone needs to stay in isolation for 14 days. So the testing is not a clearance test.
So the question is, should we be testing people at the end of the 14 days that are asymptomatic? So one of the limitations on the test that we do know is testing asymptomatic individuals is currently not the recommendation that I am aware of. Again, things are changing rapidly, minute by minute, day by day. So currently, if someone calls our organization and says, I'm asymptomatic, I need to be tested, we would not test that individual. I feel like it's probably true for Gunderson.
And what does asymptomatic mean?
No symptoms. You don't have, or the symptoms of advanced disease. So really, I was exposed. Bridget exposed me yesterday. I feel fine today. Yeah, hypothetically, thank you. Yeah, I wouldn't test.
Another Facebook question, can you speak to the speed of testing results and what is being done to maintain that speed or increase it?
So I'll just say that across both health systems, what we're seeing is about a day. It could be up to 2 days, and that can have a range just depending upon the time of day when the test happens, when the test is sent out, and the results coming into our system, typically within 1 to 2 days.
Where are they being sent to?
So no, I can't speak to Gunderson. My understanding is that Mayo has a testing facility in Rochester. In Gunderson, are you online yet?
Currently, we're sending our samples
To the Wisconsin State Lab of Hygiene.
We're working on local availability, and I hope to have some new information for you soon.
Can I ask one more question for them? Is there any risk to surrounding counties and having been in contact with them?
Yes, of course, they've been in contact with surrounding counties. Health departments are close-knit communities, and so yes, they are aware that we have cases here. They will let me know when they have cases there. You know, we knew that this would happen. You would typically, in the Western region, for example, you would typically see in Eau Claire, La Crosse area, higher population levels, you would see those cases pop up there first. So nothing unexpected here. And yep, we anticipate that there will be additional cases in our region. Any other questions? I just kind of hate to ask any questions of Jane about the county operations. Obviously, this is the critical issue, but questions of Jane or me about county operations? Sorry. You've heard, yeah, we've heard from the important people. Anything else on Facebook, Megan?
We're having a lot of questions about daycares. I'm not sure that's something we need to address after the test a lot of the questions about the staff at daycares and how they impact.
Okay, so we will work on answering that. Anything else?
I have a test that in the section of classes, how well people do.
So the plan is, and will continue to be, that when we get positive test results in, what we need to do is we need to make sure that that patient has been notified of their test results before we are potentially, even though it's confidential and you wouldn't be able to determine who that is, we want them to be aware that they have positive results. So we are connecting quickly with Mayo and Gunderson to make sure that either the provider or us is going to be in contact with the patient. And then we are notifying the media is the plan, that we let folks know within 1 to 2 hours of when we get that positive test result into our electronic disease surveillance system.
Thank you again all for being here and being part of the important work that's being done to keep the community informed around the COVID-19 pandemic, and to all of our partners at the county. Thank you very much, Dr. Mulling, for being here. Bridget Path from Gunderson, thank you for being here, and I'm sure there will be interviews afterward, but thank you all for being here.